Today's adventure is brought to you by me. This is my 4-month pre-op Radical Prostaecomy checkup. It's early. Normally it would have been 6 months, but it's early. Let's head right to it. Okay, so normally after you get your surgery, you spend the night there. A week later, they remove the catheter. And then I think a week after that, or 2 weeks after that, oh no, a week after that, you see your doctor. Then from that point, it's 6 months. From that point, you see him. That's your surgeon, not your primary now. Now, I've been bleeding for the past... In the past 4 months, I've had 2 urinary bleeds. The first one I went to the surgeon, and of course, then I had pain still. I was still tender. First one I went to my surgeon, gave me some antibiotics, and then it cleared it up. All of a sudden, I'm bleeding again recently. This time I went to my primary, thinking if it was just a UTI or some kind of infection, then why bother my surgeon driving all the way to Tampa? So then, after taking my urine test, my primary says, no, I need to go back to my surgeon because the blood that's coming through my urine is not bacterial or anything to do with UTIs. It's something to do with the surgery. Then I was explaining how, now my number 2s are feeling like they're getting hard to hold. And he did a checkup, which I'll explain all that when I get my whatchamacallit. He says my muscles are still weak down there. So then he sent me for a CT scan. So that'll be another video on that. Alright guys, my main concern today, which I have a lot, is I don't think the day that I went here and got explained on what he was going to do to me, because he was supposed to cut me in my jingle bells, and he didn't cut me in my jingle bells. He cut me a different way, which is he went through my stomach, which is practically, I would say, the long way to get to my prostate. So this is a new surgery process, and I wanted to make sure that I heard clear. Or why was it changed? Was it changed because of the Chinese virus? I don't know why. My other second concern is like, I was never told I was going to get needles down there in my private area to bring back my erections. The way they made it sound like was, oh, it'll come back to you. So I'm thinking pills. Well, no one didn't tell me I have to get 3 ejections a week down there to just keep that going and not to lose that. I mean, and the pain, why am I still sore? You say I could get back to work 3 to 4 weeks, but I gotta lift 50-pound bags. But then in my last time I've seen the doctor, he told me I can only lift 15 pounds. So I'm still out of work 4 months. So that's my main concern is how long is it for me? I'm not saying that there's people out there that didn't recover quicker. They got the 3 weeks, but that could be office people. That could be a mechanic, someone who's not lifting. I have to lift. When I lift, I pee at least 12 inches far. So just imagine how I'm filling up a diaper at work. No one wants to work like that. So I got some concerns, and this is going to take me a year, personally, because possibly this was done a new way, then I need to know. I mean, I need to get myself prepared, because this is not what I thought was going to happen. And like I said, shame on me for not listening, because in the COVID state, you're only allowed here by yourself. So if you're one of those person that used to go in there with somebody else and they'd listen and you didn't, well, guess what? Now you got to listen. Well, I'm here. I'll try to get you guys in as close as I can and let you know what's going on. This is the catheter bathroom. You see that bucket right there? You literally have to sit there with your pants off, okay? And you have to, when they fill your catheter up, you're sitting here and she fills your catheter and then she pulls it while you're embraced in that chair. I have nightmares about that. If you don't put no pee in there, they don't let you go. But that's the catheter removal chair that I have nightmares about.
The blood test looks fine. Okay. We're happy with that, okay? The blood in the urine, that can be just some scab inside where the scar is healing inside. I'm not going to go too crazy about it. Just finish the antibiotic. Yeah, we don't need to do a camera right now, okay? But if it doesn't get better in the next month or two, then yeah, I'm going to have to take a look, okay? But just finish the antibiotic and just make sure you stay hydrated, okay? You have weakness in your pelvis.
Pelvic floor.
Your pelvic floor after the
Gotcha.
surgery has not recovered. All your muscles that are involved with holding the urine back
Right.
and holding the stool back, okay, are involved. And
Yeah.
after the surgery, they just haven't healed.
Okay.
Okay. So one of the things we should going to do is make sure the pelvic floor exercises, the physical therapist, you got to do it. They will really help with you. I know is what a lot of guys can go through. Okay.
Okay.
It's just a matter of it's just time. You need more time, and you got to do the exercises.
I got you.
The pelvic floor physical therapy, you got to do the program. It will help you. Okay. The blood, with overdoing activity in the beginning and during this time, it can do that. Okay. I'm not going to go crazy about it right now. Okay.
Can I ride a bike?
But again, the blood in the bike may cause you more discomfort and may
Gotcha.
cause the bleeding right now. So I would wait a few weeks.
Okay.
Don't do it right now, but maybe in October. Okay?
Yeah.
Give it
Yeah.
a couple of weeks. You're going to get a blood test in 4 months.
Okay.
Okay? And then we'll go from there, bud.
Alrighty. So, this is where I'm at with the doctor. Other than the new procedure coming from the top, healing time is the same. Now I can start lifting up stuff, but I have to gradually work my way to it. So I'm not going to be able to go lift up a sofa, but if I have to lift 50 pounds, that's good. So I can gradually start working. If I had to do an oil change on the car, I can do it. So those are good things. Get back into walking. Now biking might irritate it, he says. To keep an eye on the bleeding. If I did bleed again, there's a possibility they have to go down in there with a scope, which is where they go down the same route the catheter went to. And I already told him that no way, Jose, nothing unless I'm out like a light. Nobody will ever put a catheter or anything in there. And as you've seen in the video when I was in the bathroom to take that pee test to see if I had blood, which I didn't. So you've seen that, and that is what I had to go through. That was the torture, see. That is what gave me PTSD. What a beautiful sky in Florida. But I promise you, no one will ever stick anything in that hole again while I'm awake. I don't even care if it's life or death. There's no way. So now, I gotta start, and as far as the muscle weakness that I'm having, it's still too soon. I mean, it can literally take a year. So rushing me back to work because I still have the leaking problem. But I can do stuff now. Now, whether my other issues that are going on with the widespread pain, you know, the restless leg, all that stuff that's going on through pain management, with this combined, that's what kills it when it's all together. Then, of course, I have at least 6 months of injections in my private area, you know, 2 to 3 times a week. And that's what I mean. When you go to your surgeon, you're not going to get the same results like with a doctor. With a doctor, you'll have a plan. He prints out that plan for you. You know, he makes the note. Surgeons, they don't give out pain medicine. Okay? And they don't give out plans, written plans. I mean, it's just like I told him, I don't want a date on recovery if it's not going to happen by then. So in other words, don't tell me that I can be back to work 3 weeks, but then again, you really can't be back to work 3 weeks. It's a possibility. You could be out of work, heavy lifting work. You could be out 6 months to a year. And that's where my job is. I do a lot of lifting. Now, the disadvantage if I don't do lifting, then what I'll be doing is then my hours would change, and then I would be doing something shittier than that. So why am I going to deprive myself where a position where I had a higher position that I worked up to, you know, to go back down to a nothing position, you know, where the hours are even crazier than. Forget that. So that's a good thing. So now with that, I go when I see my regular doctor, and that's the gentleman that's going to make the note for me that would tell me, you know, to take this recovery slow. So that's where I'll get my plan of action from. And it's possibly the same thing with my pain management. They'll be, you know, they'll give me as well something to follow. So that's going on there today. I don't see him for in January. I see him before January. I will have to take another P test, and I have to take another blood test. So every 6 months, let's see, September, October, well, every 4 months to 6 months, basically, that's my routine with him. I can do that same routine with my primary doctor, but these people, they want to keep an eye on their work. And a lot of people, a lot of doctors, especially surgeons, they do not like to work on other people's work. But the good thing about this is that now with any other problem from this point, I can, my medical, the doctor I go to, they have in Florida Medical, they're all over. So everything is done within them. So you never have to go outside, so it's much easier. So if I did have a problem from here on with the leaking, then my personal doctor now can set me up. Instead of having my surgeon to refer me, I can have my personal doctor refer me to doctors that are in the system. So that's a good thing. So, I mean, recovery is coming along. But again, I have widespread pain syndrome, which is part of the fibromyalgia family. And as you've seen, I had that shot in my back. So, you know, the nerve system in my body is just out of whack. That's something I just have to deal with the rest of my life. Do the Vicodins help? Yes. Do I want to take Vicodins? No. You know, do I have a choice? Yes and no. I have a choice. need the Vicodin, I'll choose it. If I don't need it, then of course I won't take it that day. I'll take something else. I'll put cream on it. Well, if you got any questions about the prostate pre-op, remember this is post-op, 4 months, and the recovery's coming. Everyone's different. I've heard stories where people have gone back to work after a month. That's fine. They're sitting in the desk. They can wear their diaper. You know, they might be business owners. I'm happy for you. You know, if you happen to work a job where, you know, it's physical, well, those are different options there. That recovery there to get yourself back mentally and physically, that takes longer. Because like I said, we'll know now more how I am now that I'm able, now that I got permission to lift. Now I'm going to see where my body is really at, because I really haven't been doing nothing physical for 4 months. So that's going to be the next challenge. Until the next video, if you guys got any questions, just give me a comment on the below, and I'll be happy to help you.